All right, we have a lot to cover today, so I know people are going to be joining, and I'm just going to get started, and hopefully most people will be able to join before we get into the real meat of the presentation. So today we're here to talk about HIPAA. So today's training is called Your Guide to HIPAA Training Essentials. My name is Penny Bartelt. I am one of the Behavioral Health Project Specialists on the BH Connect team. So today we're going to talk about the importance of HIPAA, what the training essentials are, and some key topics around social media and mobile device security. I'm going to mention that this is a PowerPoint this presentation is being recorded. The PowerPoint is going to have some links to things, some really good resources. So if you didn't register through our online platform, please make sure you put in the chat your name and your email. So we always like to follow up by sending a copy of the PowerPoint, and that gives you all those links to all the resources and things like that. So just want to stress again that if you're not sure if you registered or not, please put in the chat so we can follow up with you and make sure you get everything. All right, so let's get started. So why is HIPAA training important? Most of you probably know this, that's why you're here. It is a legal compliance type thing where that's one reason it's really important, that HIPAA is a federal law that you must comply with. So it helps protect patient privacy. It's important that employees understand how to safeguard protected health information. And then it helps reduce that risk of unauthorized disclosures and breach as well. So if you've worked with me, you've heard me say this, human error is one of our biggest threats to our security of our information. And there's a whole bunch of data. I just included one article from the HIPAA journal that 70% of healthcare data breaches are caused by insiders. And there's a whole range when it looks at if it's human error or things like that. But training is a really nice way to reduce those human errors. It helps maintain your organizational, that's a tough word today for me, reputation. So not making the news is a good thing for a HIPAA violation, right? So we all have seen the reports of people who've had things happen, and we know that can lead to some loss of client confidence and hurt our reputation. It also empowers employees to learn what they can and cannot do with PHI. This helps reduce those confusion, mistakes, and also it's important to have those reporting procedures that staff know what those are. So who needs HIPAA training? Well, all of you that are here need it. You're all healthcare providers. You all are billing and following the HIPAA rules. Your business associate, so anyone who is handling PHI on your behalf, also needs to make sure they have HIPAA training. Your staff needs the HIPAA training, as well as those students, trainees, interns, they all need HIPAA training as well. So when should training be provided? So there's a couple key times. One is onboarding. So before you grant access to PHI, really need to make sure that they understand what HIPAA involves. And HIPAA, of course, has their lovely time frame. So it just says within a reasonable period of time. So they don't define it, but I think we all know that for protection of PHI before granting access really is the best way to provide that training. Then there's annual training, which is really a refresher on all the requirements. And ongoing security awareness and training program is beyond your policies and procedures, doing training that enhances that staff resilience against online threats. So that is not a one and done type training. That is those periodic reminders that we talk about providing to staff. When policies change, so looking at retraining when policies and procedures change, and you only need to train those impacted by the change. So a sanctions change would apply to all staff. If you have a change in how you handle business associate agreements, you really only need to train those that work really directly with those business associate agreements. Doesn't pay to train people who don't even do that in their job. So in addition to policy changes, having refreshers. So whenever something new is discovered, train staff how to identify it and respond to it. So that's in the moment, as things come up, that you train to it and refresh people's memory on it. When there's a new technology introduced that's maybe designed to mitigate a vulnerability or threat, that's a good time to provide some training, which you're probably providing training on that new technology or element, and it's just going to help. And you can tie HIPAA into why that's there to make those connections for staff. So what is needed for compliance? Documentation, right? We all know this. If you don't document it, it's really hard to go back and prove what you did or didn't do. So the documentation requirements are your attendance record. So who was there, the curriculum, the training dates. And it's a good idea if you don't have some formal way to track when people were there, having some kind of acknowledgement or attestation confirming they received training. This is really helpful if your training involves review the incident reporting policy or something like that, that they're signing off that they reviewed it. And part of this is important because if you have an incident that can directly be tied back to providing training on it, it at least shows that you were doing what you could to prevent something like that from happening. Accidents still happen, but at least you can show we did what we could to try to prevent this. And if you've done an SRA, you know that lovely 6-year rule. So that is the HIPAA time frame. So if OCR were to investigate or anything like that, you're able to provide your documentation for the last 6 years, depending on how long they would request it for. So what are the core training requirements? So you're training on privacy rule, security rule, and breach notification protocols. So privacy rule are your things like your permitted uses, minimum necessary, patient rights. Security rule is really on the protection of electronic protected health information, those technical aspects, all your safeguards, those types of things. And then your breach notification is how to identify, report, and document incidents and all the steps involved in that. So you also need to do organization-specific training. So, you want to cover what your organization has when it comes to certain procedures and what you require. Make it relevant to staff roles. So the best practice is to provide training to all the members of your workforce so everyone has a blanket understanding, and then you can enhance areas specific to job functions. You also want to use your risk assessment to determine the most important elements of your HIPAA training. So by doing those risk assessments, you might find things that really need to be retrained to or re-emphasized because maybe it's policy or procedures not being followed the way you might like it to be to really minimize your risks and vulnerabilities. So it's going to vary depending on what you guys are seeing in your own environment. You want to provide training as often as necessary to mitigate the risk of a HIPAA violation or a data breach. So we talked about, the requirements are, onboarding, annual, things like that. But you really want to gauge it as well to how often do you feel like you need to train to this. So some members of your workforce, that annual training, that's fine. That's all they really need. But there might be sometimes some groups of your workforce that you're talking about maybe even monthly, your monthly meeting, something's coming up and you're talking about it, or as situations come up. Really depends on people's role and what you feel is necessary to mitigate those risks. So now we're going to dive a little bit deeper into emails, social media, and devices. All right, so one thing you want to do is train to prevent HIPAA violations via email. So really train on your policies and procedures for sending HIPAA compliant emails. And I'm going to go over some potential training topics. These are things you can consider. They may not be things you do, but you might want to think about if you're not doing it, maybe starting to do it. Again, these are all just suggestions. So really training to using secure email or portals. And if you don't have those available, we actually created a document using Copilot. We recognize not everyone can use some of the chat features with AI that talks about how to password protect attachments. It was actually something I was curious about, and I looked, I'm like, oh, there's a couple different options. So that is something that we'll have linked to this PowerPoint, and it'll be out on our platform if it's nothing that you've looked at or considered before. Part of the privacy rule is that minimum necessary. That definitely is enforced for emails. You really want to do the minimum necessary in your emails with PHI. Internally, if you're emailing documents, look at using links instead of actually attaching a document. You can look at your file sharing permissions if somebody maybe wouldn't have permission to open that link. But that way, if that went to the wrong person, they can't actually open the document because the link's not going to work. Do not include EPHI in email subject line. So do not say John Doe 5/12/2020 or whatever records, right in the email subject line. We do not want to see it there. Verify email addresses before sending and avoid using that autofill for email recipients. I am guilty of having this happen where I use the email fill-in and I picked the top person because I thought I only had like one Heidi, and then I forgot that I had emailed a Heidi and accidentally sent her a request to make me a car rental. Felt very embarrassed. Luckily, it didn't have PHI in it, but I've really become very good at deleting that autofill and not trying to use that unless I really double check and verify that that is the person I want to send it to. So if your email has where it will autofill, you can, when you get to your little drop down, there'll be a little X. If you go to the right-hand side, you can click that X and it will remove the name from the list. And I do that pretty regularly for the one-offs that I don't normally email. How to handle misdirected messages. So internally, how do you handle that? Do you have an immediate recall option, or who do you need to notify if you sent somebody the wrong information? This is another one that's something to consider, is prohibit sending emails to multiple clients using that blind CC feature. And the reason for that is there's a risk of accidentally hitting the CC, and then you send it to everyone and they can see all the other recipients. And that right there could be a form of a breach. If somebody's email includes their name, then everyone can on that email knows that that's a client of yours. And also prohibit forwarding emails to personal email addresses. So taking a work email, forwarding it to a personal email. The personal emails just do not have the security protections. And we're going to see an example of why that's a bad idea. So here's some examples. I feel like it's always nice to have real life examples of things that happen. So Delta Dental and Marshfield Clinic both had where a third party gained access to email accounts. Delta Dental was a lot longer period of time. That was, over almost a month, whereas Marshfield, it was 1 day. But in that 1 day, they reported possibly over 35,000 records that were possibly compromised. You'll notice neither of these have fines because they just happened pretty recently, so they might still be under investigation. And here's a personal email breach where, again, it had to be reported that they had this breach. This was somebody forwarding their email to a personal account. They must have spreadsheets or something in that because it involved over like approximately 8,600 patients' information, which is a lot. Again, they worked with them to ensure it was deleted, things like that. But again, it'll be interesting to see if they do get a fine and plan of correction out of this. Social media policy considerations. So this is something that, you want to say it's new, but it's been around quite a long time where hopefully many of you have social media policies, but it's important to provide training on what that is, like what's allowed, what's not allowed. So best practice is to prohibit any posts containing PHI and enforce tough sanctions on any member of the workforce that breaches this policy. So if you really no, we really need to post things, you can consider a policy that stipulates the circumstances under which it is allowable to post any information. But here's some minimum language to consider. Is that employees are prohibited from posting any protected health information on social media platforms. Any content that involves patient information must have prior written consent. Employees must conduct themselves professionally and respect the confidentiality of our patients and the organization. Did feel it's really important to note that even with a consent, social media posts cannot be completely withdrawn. Once they're out there, it's out there. So then you have the problem if the patient revokes their authorization, you can't bring it back. So that post could have been shared, captured via screenshot, or copied before removal. So it's really something to be careful of when it comes to how you handle social media. So again, a couple real life examples. In Detroit, there's a nursing home staff member posted a photo of a patient's room, seemed innocent. However, it inadvertently included a visible chart on in the picture that they posted on Instagram. So as a result, the staffer was fired. The facility paid $100,000 for a violation of patient privacy violation and lack of a social media policy. So again, it goes down to making sure you have what is acceptable or not to show, did this person follow your rules or not? So this showed that there was nothing to say that she couldn't do that. And then there's a New Jersey provider that was fined $30,000 for sharing patient information while responding to online negative reviews. So being mindful of commenting when people put things out there. I thought this is a really good graphic. There is a HIPAA journal article on social media guidelines that this comes from. Just gives a lot of examples of all the different possible violations that could happen on social media. You know, something like sharing a funny patient encounter online, you know, things like that, that people may not think are a big deal, but they are a violation. Example, and this example is one that, you know, it sounds innocent enough. They shared success stories. You know, what a great idea. It's a rehab, skilled nursing, long-term care facilities. They shared 150 of them on their website. Unfortunately, they forgot to get HIPAA authorization. So they did remove the posts after OCR was notified, but they didn't, for some reason, do breach notification letters. So OCR did settle that one for $182,000 fine. And I'm guessing there's probably some additional actions that they will need to take. So if you want to read about it, anything that's underlined is a link so you can read more about it. Electronic client search. This is something that has come up as well. So from the NASW, it says social workers should obtain informed consent, before conducting electronic searches of clients. Exceptions may arise when the search is for the purpose of protecting the client or other people from foreseeable or imminent harm or for compelling professional reasons. So you want to train on your organization's policy on electronic searches. Do you allow people to just go look on Facebook about their clients and things like that? So you may want to consider adding informed consent to your releases on releases on how social media or electronic searches may be used if justified in the course of the work. So an acceptable use might be you have a very reliable client who always shows up, but you know, last time you saw them, they were pretty depressed and they missed an appointment. So it might be worth going to look at, like, if you know that you're on any social media, going out there looking at to see, you know, have they posted recently or anything like that. Obviously, if there's some self-harm risk that would be justified, or maybe some law enforcement concern. Bring your own device training. So this is a hot topic that's I think relevant for a lot of people. But again, you're going to train on your organization policies and procedures before you're giving access, and then on an ongoing basis. If you are in a position where you have company issued devices, maybe it's one where they sign them out, or just you would have access to them, look at them, see what they're texting and doing on those phones, and then you can address and train if there's any identified concerns. Also, we recommend a written acknowledgement of understanding and agreement to the bring your own device requirements before giving access. And some of those requirements would be agreeing that your organizational mobile device security requirements and monitoring, but also really highlighting that need to report lost or stolen devices immediately. Some security considerations, there's a whole list of them. One thing that I know our organization does is that disable copy and paste from organization sites, which, because I understand the importance of it, it is a little bit of a pain though when I want to copy and paste an address and put it in my map and I can't do it. But it really does reinforce that the protections that my organization is taking, so that, let's say if I have PHI on my phone, I can't screenshot it, I can't share that anywhere. And if you're not doing that, that is something to look at if you have that ability to do, as well as requiring strong passwords, PINs, exploiting threats like theft, malware, insecure networks, you know, not using public Wi-Fi to look up any PHI. And then, because this has been something that people have talked about as well, is I thought it would just include, I'm not going to go over all of these, the reasons why texting from your regular phone had some HIPAA compliance concerns. I know there's some pushback people give on this to people I've talked to. So I really just want to highlight, to text PHI, you need a HIPAA compliant secure messaging provider and app. And these are all the reasons why. So I found this. This is a really nice graphic, I thought, as far as the important elements of HIPAA training. And there's the link down there to the article that this comes from. It's a bigger article that I think is a really nice resource for everyone. So I use this and I developed some additional training materials, thinking we could go over all of these, or I could create some training tools that you guys can actually take back and use. So we created a Jeopardy style game, a quiz, and some training scenarios. So now I'm going to try to work the magic of stopping that and starting to show you. So for the HIPAA quiz, this is a PDF. And for this one, it's nice to have where if you hit page down and it's not quite working right, you just go to this little fit to page and you click it. And then it'll go to where if you hit page down, it'll go one screen at a time. So we have 20 questions, and really they're meant to just be something you can talk about with whoever you're doing the training with. So for this one, a nurse receives a call from someone claiming to be a patient's spouse asking for lab results. What should the nurse do? Hit page down. It gives you the question again, but then it gives you the answer. Verify identity, check patient authorization before disclosing PHI, and then the explanation. Then you can also talk about what your own policy is as far as how you verify that identity, things like that. Okay, so there's 20 items on that. And then we also created HIPAA training scenarios and explanations. So this would be a little bit more of a discussion type format. So this one is the first scenario is the friendly neighbor. So a nurse recognizes a parent in the waiting room and says, "Oh, I didn't know your son came here. How is he doing with anxiety treatment? Is that okay?" And then it proceeds to give you all of that. I will just give a little note that we use Copilot. Copilot's a really nice support to do these things. I recognize that not everyone's able to use those types of features, so wanted to at least provide these to you, but it's a great valuable tool to use the AI in that way to like put in there, can you give me some HIPAA training scenarios? And then you can tweak it, change it however you want, but just really wanted to demonstrate some ways that AI also is able to help with doing trainings like this. And then the Jeopardy style game is this. It's a Jeopardy board. Everything underlined links to the questions. So the only problem is we had it in a PDF and the links didn't change color. So we switched back to putting it in Word format, but you do have to hit Control Link, but it does when you hover, it tells you what to do. So it's not overly complicated, but you hit the link, it took me to the answer. Any information about an individual's health that identifies them is called this. And then again, you would click the link. What is protected health information? And then for many of them, we have a little bit extra information, just providing maybe some more clarification, something like that. But you can either return to what the original answer or question was, or we have a home that'll take you home. You can always hit Control Home as a shortcut way to get back to the top. So there is also a final Jeopardy question. They are HIPAA compliance officers. So really it's that opportunity to see who knows who your HIPAA compliance officers are. But because this is a generic training, we just have them listed out and then you can just say who it is. But because this is going to be in Word, you can feel free to add to this, which is really nice. You can change it to fit your needs. And then again, going back home gives you the full board. There is a Jeopardy game leader guide that talks a little bit about just the display and any tips you might need. I think there is a way, now that I think about it, if you go into view, I'm going to be able to do this. If you do read mode, I think it has where you can just click. I just remember that. So that is in the guide. So now I'm in read mode. And then to get out of it, you can go down here. I think, and I just click that one and it takes you back. So I just remember that. Sometimes I amaze myself. So what that is I'm going to go back into the PowerPoint now. If I can manage all my screens. So what that is when I was doing this presentation preparation, I created slides for all those 12 areas. And what I did is I actually took all of the information from these slides and, well, almost all the information from the slides and put it in that Jeopardy game. So right here, it's just a little bit more like, what would you think about, what to think about doing, how to explain these things. So if you want to do more of a PowerPoint, by all means, you could use this PowerPoint and change it to your need. One thing that's not in the Jeopardy game is this chart of the penalties. And I just wanted to touch base on it because it is, it's sometimes staggering to see the amounts of a violation can cause you, right? So, and I did want to highlight that for OCR, failure to train staff is often considered willful neglect, which is this tier 3 level. So if you knew that training was required but didn't implement it or do it, that puts you at risk for a higher fine possibly as well. And just thought I'd also point out to like these class action lawsuits. I think we're all starting to see those in the news now as well, where more and more lawsuits are being filed as a result of breaches and things like that. So Anthem in 2015 had $115 million class action settlement. So unfortunately that happens. And then I just want to highlight as well, you do want to talk about, let me go back. Incident training, it's very important to cover what your organization's incident policy and procedure is and how to report those. And then I did want to point out, we did create another resource in case people are interested, but just on what a designated record set is, so that if you wanted to know more about it, that we do have that. So we are going to put a poll question up, because actually I did pretty good on time. I apologize for talking quickly, but the poll question we're going to ask is if you would like us to do a part 2 to this training where we go over the second half of slides in a little bit more detail. It became a matter of this probably could have been an hour-long training, and instead it is a lot to cover in a half hour. So wanting to know if you guys would find value in taking another half hour in probably March. So we put a poll question up if you're willing to answer that. And then what I would do is I would go over the other half of the slides where we go over each topic a little bit more, and then hopefully have a little bit of time for questions. But thought I'd ask because some people might be like, you know what, I got the PowerPoint, I'll just read through it, I'm good. And some other people might be, oh, I'd really like a little bit of time to slow down a moment, read through them a little bit more. So trying to do the best of both worlds by really covering some of those early topics and then the standard privacy, security type things, leaving those for you to either look at on your own or do a part 2. So I did pretty good. I got 2 minutes. Is there any questions or anything immediate? I will emphasize again, if you didn't register via our platform, please make sure you put your name and email in the chat so we can make sure we follow up by sending you the PowerPoint, the recording, and then you'll have links to the Jeopardy style game, the quiz, and the scenario that they're out on the platform as well. So I don't know if there's any questions or anything in the chat. Hopefully people found this helpful, and be interested if there's any feedback on any of the tools or anything too, always let us know. If they're in Word, feel free to edit anything. The user's guide, the Jeopardy style user guide does emphasize some places where you really want to emphasize your own policy and procedures. So again, when you talk about incidents, that's the time to really train to what your incident response policy and procedure is. That's a very important training to do. As we talked about, human error is a big part of our risk, and really emphasizing the training to prevent it, what they can do to prevent it, but if something does happen, what they need to do. Okay. Right. Well, 1 minute left. If anyone has anything, they could come off mute and share anything or put it in the chat. Maybe we'll stay on for a couple of minutes. And please fill out the poll. That's very helpful for us to know if we should just revisit this topic in March. And next month, stay tuned. Not stay tuned, but don't hang on for it. It's in March. Courtney, I'm blanking on the date because I don't have my calendar in front of me, but we're talking about artificial intelligence next month. So you got a little sneak peek of how you can use it.
February 25th.
Thank you, Courtney, from 12 to 12:30, another lunch and learn. So hopefully these are working for people. But that's what we got. We're at time. So thank you everyone for joining us today. Really appreciate you guys taking time out of your busy days to join us for this topic. So have a great day. Bye.